Hi, I'm Nancy Skinner. Welcome to this edition of Next Way's Leadership Forum. Today we're talking about a topic that's very important, will be for the next 2 decades, and that's healthcare, as we have an aging population and many financial challenges within that. So, Affordable Home Care Act was passed, and it was recently upheld, in fact, by the Sixth Circuit Appeals Court. So it will go forward. And it's going to bring many changes to the industry, all across the spectrum, from hospitals to providers to nursing homes to home health care providers to patients. So we wanted to take a minute and talk to someone who's kind of been at the forefront of thinking through these models way ahead of time. And in fact, he has done just that. John Byrne is a CEO of Integrity Home Health Care, and because of his own personal situation, he figured out a lot of the bumps in the roads and what needed to be done, and has a lot of great analysis as far as the official acts have, the Home Care Act has gone, or the Health Care Act has gone. Before we get into the weeds on what the problems with the healthcare, which I know we could spend days on,
we could,
and we can't. I want the personal story a little bit. Tell us how it is that you figured out that the system was broken.
Well, my background is healthcare finance, and so for 25 years when someone would ask me, what field are you in, I would say I'm in healthcare. It wasn't until my parents became old and very frail, and with the assistance of my 5 brothers and sisters, we were thrown into the active act of providing healthcare to our parents. Then I realized I wasn't in healthcare. Healthcare is a profoundly personal deal that has many people involved in it. And as we were caring for our parents and helping them go from one setting to another, hospital to nursing home to home health, physician clinics, outpatient rehab, it became really apparent to me that there's so much fragmentation. And within the fragmentation, there's so much opportunity to improve the care that I decided to get into this myself.
Great. So you started Integrity Home Health Care.
Correct.
Now, so that's one. It seems to me that that's going to be, home health care is going to be one of the biggest solutions to the problems that we face with home health care, because the hospitals are, just so darn expensive. My mom had a stent put in last week, and at 80, and I think her bill for one day was $8,000.
Healthcare is very expensive. We know that the costs are increasing as the population ages. I don't see that changing. What we do see is the technology is so advanced, and there are things available in the healthcare community that a lot of people are unaware of, like home health care. We are a Medicare certified home health agency. We send nurses, therapists, physical and occupational therapists, speech therapists into the home health aides, subsequent to a physician order prescribing that service. There are many things that can be done in less costly settings, non-hospital settings. Hospitals are very important places, and we have to have them. But as technology progresses, as the cost imperative of getting healthcare, the growth of healthcare costs down, we have to look to alternatives. And one of the alternatives is finding ways to keep people in the home. The home's a far happier place to be than in a hospital. Hospitals are incredibly necessary, but nobody wants to go there. Nobody volunteers to go to a hospital.
Right.
You do want to be in the home. If we can keep more people in the home, they're happier. We'll have to keep them healthier to keep them in the home. Everybody wins. As my mom would say, my parents both passed away in the last 6-7 months. As my mom would say, there are no visiting hours in the home. It's a much better place for all of us to be.
How is the level of care in a home? How do you compare that to the level of care in a hospital? Can you get to the same level of competence and expertise?
You have the same skill sets with the nurses and the therapists in the home. We are big advocates of having doctors visit in the home. If we can be proactive and see people in the home on an intermittent proactive basis, the chance of a hospitalization will be significantly reduced. Many cases we have prevented my dad from having to go to the hospital because we brought resources into the home that a lot of people don't know that they exist. So we had house call physicians coming in. We would have those house call doctors talk to my therapists and my nurses. That was a much better clinical model. Now, hospitals are necessary things. People get struck by lightning, say. People have heart attacks. You need to be in the hospital. But it's a really expensive case, as you were citing with your mom's stent. It's incredibly expensive, and it's a necessary expense because there are so many talented people and there's so many resources that hospitals have to cover every eventuality. But if we can prevent just a handful of hospital stays by being more proactive in the healthcare arena, think of the money we'll save.
Okay, let me go past that because I ended up sleeping on 2 chairs and with my mother to take care of her, and she got sick. You're forced to lay down straight for many hours after her surgery,
right.
And she got sick. So there would not have been a nurse there at the time. I happened to be there and was able to take care of that situation,
right.
as unpleasant as that is. So is there? Can you make a case that sometimes your family members are your best nurses?
You absolutely can make that case. I'm fortunate that I have 5 brothers and sisters. All 6 of us were incredibly active. I have many physician friends because I'm in the healthcare world. They were very clear to me that no one cares for a loved one except for a loved one. As good as these doctors were that took care of my mom and my dad, as good as the nurses were in the hospitals that they went to, they weren't related. When it's your parent, you have to get actively involved. The benefit that I had is that I am in healthcare, so I know the system. The system is very fragmented. It's very complicated. So there are a lot of people who are at home right now wondering, how am I going to get the care that I need? And what happens far too often is they get the care when it's an emergency. So rather than someone being in the home and proactively caring for them, they wind up in the emergency room because they're not getting what they need. The emergency room, they get admitted to the hospital. And then the whole trajectory starts through the ER to the hospital. In the case of an elderly person like my mom and my dad were, they would spend a week or 2 in the hospital, 2 to 3 weeks in a nursing home for post-acute rehab, then go home to home care, and then go to an outpatient rehab facility. So if you add all that up, it's incredibly expensive.
It is. So we've covered the fact that home health care is, the quality is there, the affordability is there. Right. Why hasn't this become part of, as the free market tourists would say, why hasn't it become just part of the way we do business?
In the future, I'm almost certain that it will be. Whether you like or dislike health care reform is irrelevant to me. We all know that it's not sustainable the way that it's currently delivered. We have embedded in our current system certain economic incentives. Hospitals get paid to admit patients, so they admit patients. Nursing homes get paid to have what they say are heads in beds, so they admit patients. Through healthcare reform, there is an opportunity, if people are willing enough to look at it, there is an opportunity to find a way to change the dynamic, to get hospitals, nursing homes, home health agencies to collaborate on a more proactive basis. Here at Next Wave, which I'm partnering with, we are working on a software package that will communicate across providers. The most important relationship in healthcare, in my opinion, is between a patient and their physician. What happens far too often today is patients will move from one setting to another and the physician may be totally unaware that they're in the hospital or they're in a nursing home. What we want to do is we want to make it easy for a provider, a doctor, a nursing home, a hospital in particular, to go online and say, oh, these are our collaborative partners. Here's where our patients are. Here's where we believe they'll be in the next step, and return them whenever possible, according to the patient's choice, back to their primary care doctor.
Now, I want to get into that, the whole new world of how
Sure.
healthcare will look. But before we do that, your company, Integrity Home Healthcare, how did you build it up? How do you staff it? What do you think is special or unique about your providers? Were there things that you insisted on that be part of that business? Because you are the creme de la creme. So how do you do that?
We have you can tell I have a passion for this.
Yes.
I've seen the benefits for my mom and my dad. My whole family has seen the benefits. I get calls from friends who have parents who are in the same situation as you're finding yourself now, Nancy. We know that in order to do this, you have to do it one way, and that's the clinically correct way. There's way too much money washing through healthcare that makes it easy for certain people to just get in the business because there's money in the business. We got in the business because I have a lot of friends in the healthcare market because I've spent 25 years in healthcare finance. I serve on numerous healthcare boards around town. So I have a lot of contacts that I knew that I'd be able to grow the business in such a way and in such a manner that we would have some success, and we could take that success, and with that success comes some financial reward. We would take that financial reward and try and develop a better mousetrap. That's the purpose of Integrity Home Healthcare. So anyone who comes to see this, anyone who interviews with us, all of the employees we have, understand completely that we're not just here to provide the best in-home care that we can. We're here to try and change the dynamic.
And before we get to that, John, do you ever go visit your own patients?
It's been a while. I'm going to say no, but the real answer is yes. We take care of a lot of people that are friends of mine. So yeah, I do see them. I get feedback. I get a lot of positive feedback. The best phone calls that I get are from people I don't know. A gentleman called me on my cell phone and said, "Are you John Byrne?" I said, "Yes, I am."
That depends.
Well, I readily admitted that I am. More often than not, that's not a bad thing. So I said, "Yes, I am." And then he started to tell me what a wonderful service that we had provided to his mom that I've never met. Those, I can live off of that for weeks or months.
Yeah, that's very great. Well, John, you know, this is going to be a very important service as we age as a population.
It will be.
And great, and it's a more cost-effective, more humane service, and I think probably provides better health care than some sort of mass system, and you're on the leading edge of developing where it should be. So, Integrity Home Healthcare, what is your website?
IntegrityHomeHealth.net.
Okay, great. So, John, I want everyone to visit your
Please do.
your website and learn more about what you've learned through experience.
Thank you.